Hello, this is Dr. Debayan Tarafdar. I am an ENT surgeon and head neck surgeon practicing in Kolkata. And today we are going to discuss about a very interesting topic and very commonly encountered topic nowadays, which is called adenoid gland enlargement in pediatric population. We see a lot of patients nowadays either directly walking in or being referred by pediatricians to us with the complaints of recurrent cold, nasal obstruction, snoring at night, mouth breathing whenever he is sleeping, and he will have recurrent ear issues as well. He will complain of ear pain or ear itching, or sometimes he will say that my ear is getting clogged recurrently. Whenever you are handing over the TV or mobile, he is always going to annoy you to increase the volume. This kind of signs should warrant a ENT checkup for your child. So what is adenoid gland? Now, adenoid gland is a lymphoid gland which is situated behind our nose. It is right behind the nose, where the nose almost meets the throat. It is in the nasopharynx, junction point between nose and throat. So that's a very important part, because that area, if blocked, will prevent any breath which you take via nose to go inside your respiratory tract. Adenoid gland is a lymphoid gland. Alongside tonsils and other lymphoid glands in and around our nose and mouth, they provide us with immunity. They are like our primary protectors. So what is their function? Their function is to prevent any viruses or bacteria to enter our respiratory tract directly by getting inflamed first. So they are the first responders. They will get inflamed first, and they will prevent any massive infection to go down to our respiratory tract. So that's a good thing. These glands are very important in our body, and hence for any individual it is common to have a bigger adenoid gland at the age of 2 to 3 years. And eventually, as the other immune system develops in our body, after the age of 3 years, the gland will gradually it will shrink in size, the body will reduce its size, and by the age of roughly saying 10 to 12 years, the gland should completely disappear. And that is normal for 85 to 90% of people. The remaining 10 to 15% kids who are having recurrent nasal blockage, recurrent snoring, because the adenoid gland is too big and body is not able to regress it further down. If adenoid is your guard whom you have kept to safeguard your house, if the guard becomes very arrogant, he's not allowing your neighbors to enter, he's not allowing your parents, your relatives, your friends to enter your house, you are not supposed to keep such a guard, right? If the adenoid gland, instead of protecting our body, if it is harboring pathogens, bacteria and viruses can colonize the gland, in that case it is not providing your kid with immunity, it is in turn harming your kid's immunity by getting infected recurrently. Nowadays, we evaluate almost all our pediatric patients with pediatric endoscopies. We have very thin, very small endoscopes which can be very safely and without any pain used to evaluate the nasal cavity or the nasopharynx of any kid who is 1.5 years old. And we are routinely doing it in our OPDs, and hence we know for a fact that at the age of 4 to 5, if you have a grade 3 or more or bigger adenoid, it is highly unlikely that it will regress by the age of 10 or by the age of 12 or by the age of 15 or even in your adulthood. That's where we intervene. We don't intervene for 85 to 90% of the people where adenoid is normal size. We'll not do anything to them. We'll just counsel them and we'll evaluate it periodically. But if a kid is coming with a grade 3 or grade 4 adenoid, which is completely blocking the nasopharyngeal airway, and second thing, it is causing physical obstruction to the eustachian tube opening. Eustachian tubes are tubes which connects the nose to the ears. The gland is too big, it is causing the blockage of the eustachian tube, called chronic obstructive eustachian dysfunction, and that will in turn give rise to ear pathology. There will be fluid accumulation inside the ear. The most common cause of reversible hearing loss in children is eustachian tube dysfunction, and the most common cause of eustachian tube dysfunction in children is adenoid enlargement. not only that, kids snoring itself is not normal. If your kid is snoring recurrently, that means there is narrowing of the air passage inside his or her nose, nasopharynx or throat, or in that whole passage. So he or she should be evaluated by an ENT, preferably with an endoscope like we do. In such cases, the advice will be a surgical excision. Now, surgery sounds scary to any parent, I can understand that. We have seen a lot of parents actually not able to take the decision when we have suggested them first. Like at the age of 5, for example, some kid has come to us, we have evaluated, we have seen grade 4 adenoid, we have advised the patient that we should get the adenoid removed, but the parents have not agreed to make the kid undergo the surgical procedure. And then the kid has repeatedly visited us at the age of 6, at the age of 7, then 8, then 10, then 12, then 15. And every time we have evaluated the kid with an endoscope, the gland remains the same. It is unfortunate that we have seen a lot of kids, because of decision dilemma, suffering a lot because they cannot take decision for themselves. It is upon their parents to take the call for them. Nowadays, we do adenoidectomy exclusively with a beautiful instrument which is called coblation. We can completely remove the adenoid under endoscopic vision without even a single drop of blood. So it's a bloodless operation. It does not char, it does not burn. So your post-operative pain is almost zero. You can go and see that the snoring and every other obstructive features like struggled breathing, snoring and everything has reduced significantly and the next very day of the surgery. To sum it up, adenoid gland is a very important lymphoid gland in our body. It contributes towards the immunity in early childhood. In 85% people, the gland usually disappears by the age of 10 to 12. But in 15%, the gland remains too big for the body to regress it. In those cases, surgical excision is the way to go. Thanks to coblation technology, nowadays we can safely remove the adenoid without spilling a drop of blood, and it is virtually painless. So, after surgery, the next very morning, the child will be as good as new. Hopefully, you have learned something from this video. Thank you. Thank you for listening to my words. And if you have any queries, you can drop down some comments. Thank you guys. And if you like such contents, please subscribe to my channel and hit a like for this video. Thank you. Have a nice day.